Now you have a patient at your clinic, he's walking in, and you are basically diagnosing him, or you're suspicious that he's suffering from some sort of a tic disorder. You have noted down those sudden, non rhythmic, involuntary, and sudden movements or phonations in that particular person, and you are suspicious that he's suffering from the range of variants that are available in these tic disorders, ranging from the motor tic disorders, the vocal tic disorders. Either it can be a Tourette's syndrome in which the person has tics, and along with that, he's suffering from the OCDs, that is the obsessive compulsive disorder on one hand. Either he's suffering from the ADHD, that is the attention deficit hyperactivity syndrome, as well as he has some sort of behavioral or cognitive problems as well. So this is the combination of symptoms that is usually present in a Tourette syndrome. And whenever you are diagnosing a person to be suffering from Tourette syndrome, these symptomatologies or these comorbidities should be present in that particular person whom you're talking about. So over here, the diagnosis is again made on the DSM-4 criteria. One should know what that criteria is while you are labeling or documenting a person to be suffering from the tic disorders, because again, it's going to implement the treatment modalities that we're going to confine to in that particular person, the particular variant he's suffering from. Either he's suffering from the coprolalia, echolalias, the copropraxias, or the echopraxias, in which the person has that mirror imaging imitating techniques that he's following on. So these are the different diagnostic criteria that we'll be discussing over here. Along with that, we'll be focusing on the frequency of these tic disorders. Again, the epidemiology of any psychiatric condition is very important to know, just to get to know how much prevalent it is in these societies. The duration is again very important. Whenever you're diagnosing a person to be suffering from Tourette syndrome, the person should have the motor as well as the vocal tics for more than a year. So this is the duration that is specified for the Tourette's syndrome. So being a working psychiatrist or a clinician, you should know these durations so that you can diagnose a person correctly. Then we have the other symptomatologies or the other comorbidities that are sometimes present along with this tic disorder. So one should focus on these comorbidities or on these other symptomatologies that are usually present in that particular person that we are talking about. And we'll be discussing all of this over here in this section, which is known as the tic disorders. Now, knowing the frequency and the duration of tics, as we were already focusing along, it's sometimes quite an underrated problem. Usually the people go through these phonations, these non-rhythmic, again, these involuntary phonations, or these sounds that are uttered, or these words that are uttered, phrases even that are uttered by the person, and that are obviously involuntary for that person. If you take the history in a particular sense, you will get to know that these symptoms or these uttering of the phonations are involuntary if you take the history quite closely. And again, if you observe the motor tics, you will get to know that these are sudden, and these are sudden in their nature as well as they're involuntary, and they're non-rhythmic in their nature as well. Individual feels the need to perform the tic repeatedly or in specific ways unless it has been done just the right way. Tics often emitted in bouts of one or the several tics by that particular person. So usually it's not a single episode. Sometimes they are usually appearing in bouts, or they are appearing in number in that particular person in that particular phase. Separated by periods without tics lasting seconds to hours, and then generally disappear during the sleep or the intense sexual arousal. So this is again very important to focus on. Change in the severity over the course of the day. Usually, even in the course of the day, the frequency or the duration of the tics will change for that particular person. Then that may also change in location over time and may vary in their frequencies and even in their disruptiveness. So all of this, the episodes should be closely observed in that particular person. The duration of the tics should be observed, and the number of the tics that is performed in a single episode should also be observed. And whether these tics are benefited from these sleep or the intense sexual arousals or not, that should also be documented while you're taking the history from that person. So when do these tics occur? That is again very important over here to focus on. Often more frequent when an individual relaxes in private watching TV, or less frequent when an individual engages in directed, effortful activity, for example, reading. So these are the particular situation in which these tics can occur more frequently when the person is relaxing or when the person is engaging in a directed, effortful activity, for example, reading. So these are some of the phenomena that have to be kept in mind. Maybe exacerbated during the periods of stress. So stress is one of the external factor that can exacerbate the condition of a tic in a person. The other symptoms that can also be included in this particular person or the child who is suffering from these tic disorders, the other abnormal movements they may develop along with it. For example, if the person initially had the motor tics, for example, the blinking of the eye, as can be seen in this picture, and then sometimes it is coupled with the other vocal tics as well, or the other forms of the motor complex tics variant. So these are the different varieties that can be present in a person in a single time as well. The behavioral patterns can also develop in this particular person when we're talking about it. Then the person can have the stuttering or the sticking out of the tongue. So these are the different gestures. It can be just the nodding of the head, the tensing of the neck, the flaying of the shoulders, the shrugging of the shoulders that can be present in that particular person, and that they're also regarded as tics in that person. The smelling of the objects is one of the kind of the complex variant of the motor tics. And then we have pounding the chest or the body. This is another variant. Grabbing at one's genitals is one of the variants of the tics. Compulsive touching phenomena, bruxism, and the echopraxia, in which we've already discussed or defined this condition is to be having the mirror activities of the person in front of him. So then we have the DSM-4 criteria at our hands, and one should know this criteria. Both multiple motor or one or more vocal tics has been present at some time during the illness, although not necessarily concurrently present in a single person, occur many times a day, usually in bouts nearly every day. The criteria should include intermittent presence throughout a period of more than 1 year. To define that person to be suffering from this tic disorder, onset is before the age of 18 years. Then disturbance not due to the direct physiological effects of the substance misuse or the stimulants can sometimes prevail this condition, which is quite similar to the tic disorders, or general medical condition, for example, the Huntington's disease or the post-viral encephalitis condition can also mimic this condition, such as the tic disorders. So in this section, basically, we summarized the diagnostic criteria which we have to follow when we are diagnosing a case of a tic disorder or the Tourette syndrome on the other hand. So that is the end of this section. Thank you for watching sqadia.com.